Hello, everyone. Thank you for joining us today. Today, I'm going to talk to you about Security Health Plan's individual and family plan options. We'll also cover what the health insurance marketplace is and how you can take advantage of savings when you enroll through the marketplace. Let's get started. Who are we? Security Health Plan, a part of Marshfield Clinic Health System, is a not-for-profit health maintenance organization. We are committed to improving your health, managing healthcare costs, and providing you with a high-quality healthcare experience. As a combined healthcare system with Sanford Health, we will strengthen rural care delivery, utilize innovative technology to provide a broader range of virtual services, unlock greater research capabilities, and transform your experience to ensure every patient receives the best care no matter where you live. Security Health Plan has been helping Wisconsinites obtain affordable health care since 1971, when we were founded as the Greater Marshfield Community Health Plan, the first health maintenance organization in Wisconsin and the first rural HMO in the nation. Now we serve more than 205,000 members across Wisconsin. Before we get into what Security Health Plan can offer you, let's go through some common questions about the marketplace and health insurance overall. What is the marketplace? The marketplace is like an online shopping site for health insurance. It's a place where you can compare different health insurance plans side by side to see which one fits your needs and budget. Also known as the Health Insurance Exchange, the marketplace was set up under the Affordable Care Act to make it easier for people to find and buy health insurance. Is the government the only carrier? No. In fact, the government is not a carrier at all. The federal government runs the marketplace as well as the coverage and financing rules. The actual insurance plans are offered by private insurance companies like Security Health Plan. The government helps regulate plans and provide financial assistance if you qualify. But the coverage you get is from a private company, not directly from the government. Do I have to enroll on the marketplace? No, there are other ways to obtain health coverage. Using the marketplace can be helpful because it allows you to compare different plans in one place and see if you qualify for financial assistance to lower your costs. To take advantage of cost savings like premium tax credits and subsidies, you must enroll in a plan on the marketplace. The Affordable Care Act was enacted in 2010 to improve access to health insurance and make health care costs more affordable. And benefits have been expanded. For example, there are no annual and lifetime dollar limits on coverage anymore. This applies to individual and family plans only. The expanded benefits are designed to make health insurance more comprehensive, affordable, and accessible for you. Overall, they aim to create a more equitable and supportive healthcare system by ensuring more people have access to high-quality, affordable care. One key takeaway from your healthcare coverage expansion is that essential benefits are provided in all plans. Under this expansion, the ACA requires that all health insurance plans cover a set of essential health benefits to ensure that everyone has access to basic health care. These essential health benefits include the 10 categories you see on your screen. These required benefits mean that insurance companies have to offer a comprehensive range of services, helping people get the care they need without surprise gaps in coverage. It is important to update your application on healthcare.gov. If you don't, you risk missing out on these cost savings. Cost-sharing reductions reduce out-of-pocket expenses for silver tier plans. Out-of-pocket expenses are your expenses for medical care that aren't reimbursed by insurance such as deductibles, coinsurance, or copayments. Advance Premium Tax Credit, or APTC, is a tax credit you take in advance to lower your monthly premium. APTC is not available on catastrophic plans. If you take more APTC than you qualify for, you will have to pay back the excess when you file your federal tax return. If you take less than you qualify for, you'll get the difference back in the form of a tax refund when you file your federal tax return. The enhanced financial assistance for marketplace health insurance plans is set to expire after 2025. If that happens, subsidies will return to their previous levels. This would mean some members may see higher monthly premiums, some households may no longer qualify for subsidies, and marketplace enrollment could shift as a result. These changes are not final under federal policy as decisions are made. So, how can you take advantage of those increased subsidies? If you are already enrolled in a marketplace plan, you simply need to update your application. If you are enrolled on a plan not on the marketplace or currently uninsured, go to www.securityhealth.org/IFP plans and enroll. Or you can talk with a friendly, knowledgeable, and local Security Health Plan consumer sales associate at 1-844-221-9345. Or visit one of our answer centers conveniently located within Marshfield Clinic locations and meet face-to-face with a licensed sales representative. To schedule an appointment, go to www.securityhealth.org/individual APPT. Let's cover a few more common questions. Metal tiers are a great way to segment various coverage categories. For example, if you want fewer out-of-pocket expenses, you will select coverage from a higher metal tier like gold. Specifics for each tier may vary depending on what insurance plans you compare. The metal tiers and coverages are broken down as follows. First is catastrophic. Covers regular preventative care, highest deductible and out-of-pocket costs, available for anyone over 400% of the federal poverty line who is losing access to subsidies via a hardship waiver. All catastrophic plans are high deductible health plans starting in 2026. Following that is bronze. This is best suited for low utilizers if you're healthy and mainly use preventative care. Bronze plans generally have higher deductibles and out-of-pocket costs. All bronze plans are high deductible health plans starting in 2026. Silver is next in line. If you have more healthcare needs beyond preventative care, maybe you have some prescription drug costs, this may be a good option. An important thing to consider with the silver tier is that cost-sharing reduction plans are only available on this tier. The final plan coverage type is called gold. This would be a plan for the person who is a high user of healthcare. If you have multiple health conditions, need specialty care, and take several prescription medications, this plan is a viable option. Members in the gold tier will have a lower deductible and out-of-pocket costs. A provider network is like a club of doctors, hospitals, and healthcare providers who have an agreement with your insurance company. When you see a doctor or go to a hospital that's in your network, you'll usually pay less out of your own pocket. If you go outside of your network, you might have to pay more or even the full cost of care. So it's generally cheaper and easier to use doctors and facilities that are in network with your insurance plan. All of Security Health Plan's individual and family plans, both on and off the marketplace, include Marshfield Clinic, which features access to more than 400 specialties, 14 hospitals, including the region's only children's hospital, and more than 260 clinic locations. Preventative care can help lower your risk for illness, disease, and other health problems. It can also improve your chances of living a long and healthy life with lower healthcare costs. All marketplace health plans must cover specific preventative services without charging you a copayment or coinsurance, even if you haven't met your annual deductible. Some of these services are listed on the screen now. Preventative health care is important because it focuses on keeping you healthy and catching potential health problems early before they become serious. To apply for insurance on the marketplace, you'll need details and documents about personal information like names, birth dates, and social security numbers for all individuals applying for coverage. You'll also need information about income, citizenship, and residency. taxes, and details about any health insurance coverage you currently have or had in the past year. Having this information ready will help make the application process smoother and ensure that you get the most accurate information about the insurance plans and subsidies available to you. Beginning November 1st, you'll be able to compare plan options, calculate what tax credit you might qualify for, and enroll in a new plan. The open enrollment period begins November 1st and goes until January 15th, 2026. It is encouraged that you update your applications on healthcare.gov to ensure you are receiving the maximum amount of extra financial help available. Remember, for your coverage to be effective January 1st, 2026, you must enroll by December 15th of 2025. Now you may be asking, why December 15th if the open enrollment period goes until January 15th? Any enrollments between December 16th, 2025 and January 15th of 2026 will be effective starting on February 1st of 2026. So you have until January 15th to make a plan change or to enroll. But if you want the new plan's coverage on January 1st, you need to finalize your enrollment by December 15th of 2025. How can Security Health Plan help you? Our plans are designed with you in mind. These 4 different examples illustrate the diverse needs for individual or family health insurance plans. Each of their concerns are different but important. A newly retired person may be concerned with affordable premiums until they are eligible for Medicare, whereas a young family needs to ensure their plan covers both of them plus pediatric care. An entrepreneur won't receive health care coverage from an employer, so she needs to find her own insurance, and a current college student may be on a tight budget, but they still want basic coverage for prescriptions, urgent care visits, and mental health services. These characters highlight the diverse needs people have when it comes to health insurance, depending on age, family status, employment, and health goals. By considering these different scenarios, hopefully you better understand why it's important to choose a plan that fits your unique situation. Next, I'll cover what Security Health Plan can offer you. We serve nearly 250,000 members with a service area covering 33 Wisconsin counties for our individual and family plan offerings. We offer an outstanding provider network through Marshfield Clinic and have become the 6th largest HMO in the state of Wisconsin, ranking in the top 10% of health insurance plans for quality nationwide. Our 4 plans available on the marketplace based on county of residence will be the Simply One Plan, the Enrich Plan, the Select Plan, and the Premier Plan. The first plan is the Simply One Plan, available in the counties highlighted on the screen. Simply One includes the Marshfield Clinic within its network, which provides access to more than 400 specialties, 14 hospitals including the region's only children's hospital, and more than 260 clinic locations. Several additional providers are considered in-network, with services ranging from home infusion care, skilled nursing facilities, mental health clinics, autism clinics, and home health services. Please utilize our online provider directory to see the most up-to-date and comprehensive list for each plan. The second plan is Enrich, available in Dodge County. This plan includes the Marshfield Clinic within its network, as well as UW Health and Unity Point Health Meritor. When you choose our Enrich plan, you gain access to more than 420 primary care providers, 1,076 specialists, and 22 hospitals, including 2 children's hospitals. You'll also enjoy lower co-pays for prescription drugs filled at Marshfield Clinic Pharmacy. Our next plan is called Select, available in the West and Northwest counties that are highlighted on the map. This plan offers great benefits and an affordable price. Our Select plan provider systems include Marshfield Clinic as well as Essentia Health, most Oakleaf Clinics, and Tamarack Health. Our final plan is the Premier Plan. This is our most comprehensive network plan and is available in all 33 counties, including the Simply One, Enrich, and Select service areas. If you're looking for an outstanding health insurance plan with an exceptional network of providers, Our Premier plan is for you. Premier's provider network features access to more than 10,000 providers practicing at more than 2,500 clinic locations. When you have a plan from Security Health, you get so much more than just healthcare coverage. Some of the extra perks included with our plans are as follows. Access to Care My Way telehealth services via phone or mobile app. Care My Way is available in all 50 states 24 hours a day, 7 days a week. We cover selective serotonin reuptake inhibitors or SSRIs at 100%. Each quarter will give you a $30 credit to be used towards the purchase of select over-the-counter health and wellness products from our mail order catalog. Choose from hundreds of different products, from toothpaste and vitamins to pain relievers and cold medicine. When you choose a plan with Security Health, you get coverage for important preventative care screenings at 100%, including annual wellness visit, screening colonoscopy, 2 hemoglobin A1C blood tests, covered at 100% annually for members diagnosed with diabetes, mammogram to screen for breast cancer, and Husk gives you access to premier fitness, weight loss, and wellness brands at a discount. You can also take advantage of educational materials, resources, and tools to engage and motivate you to become more active and adopt healthier behaviors. Our world-class customer service is also a perk available to each Security Health Plan member. At Security Health, we're neighbors helping neighbors. We live and work locally. When you reach out to our customer service team, you get a real live person right here in Wisconsin. And we've increased the ways you can reach us. Not only can you talk to an agent over the phone, but you can also log into your My Security Health Plan account and connect with us via live chat. And if your question isn't time sensitive, you can always send a secure message and a customer service representative will get back to you. So, you're interested in having security in your future. Now what? We make it easy to connect with us. You can call, click, or email. Call us at 1-855-862-6859. Or you can see details online at www.securityhealth.org/myplans, or you can email shp.ifp.request@securityhealth.org to request a quote. Do you have additional questions about the marketplace or health insurance in general? Security Health Plan wants to help. We have 6 answer centers conveniently located inside Marshfield Clinic locations where you can take advantage of face-to-face consultations. You can meet in person with a licensed, knowledgeable sales representative and learn which healthcare coverage is right for you. This service is free and available to everyone, even if you aren't currently a Security Health Plan member. Call 1-855-862-6859 to make an appointment or visit www.securityhealth.org/individual-APPT. On behalf of Security Health Plan, I would like to congratulate you on taking control of your health and wellness. This process can be intimidating, but it doesn't have to be. By learning more about the marketplace and different plans we offer, you're already off to a great start. When you team up with Security Health Plan, you get more than just high quality coverage. You get a partner in your health and wellness journey. Thank you and have a good day.